Dr. Hamza, I thank you for joining us. It's a pleasure and an honor, to be honest.
Thank you for inviting me here.
I know you just literally fell off the plane the second, and we got you, we swept you here, and we appreciate your contribution.
Thank you. Thank you for the invitation.
I thank Noeline for arranging it as well, in fact. Dr. Hamza, I introduced you as a body sculptor. And I know that you've just come from England, where there was this big international conference.
Yes.
And I'd like to know more about who you are and what a body sculptor does.
I'm first of all a plastic and reconstructive surgeon, so doing plastic surgery for more than 25 years. And after doing this reconstructive surgery for the bodies, I specialized in body sculpting and more aesthetic surgery, aesthetic procedure. So what are the procedures that I do? Mainly it's how we can reshape the body and giving a nice shape to the body by removing the fat from some areas and adding it to other areas. We call this lipo-augmentation and liposuction on the same time. By the meantime, we do also the breast contouring for the patients. So these are all the procedures that including the liposuction and breast surgery and lipo-augmentation, including the body sculpting, yeah.
This is all aesthetic, right? It's
all about aesthetic, yes.
Okay, all vain. It's not a matter of interventions when it's needed medically. It's all about vanity to a certain extent.
It's when the people, they don't feel comfortable with their body, so we do this procedure to help them. It's not only aesthetic, it's aesthetic surgery, but it's apart from the plastic and reconstructive surgery. If we are not plastic and reconstructive surgery, it's difficult to understand the body shape and to give the nice contour for this body shape.
Okay.
So it's important for us as a reconstructive surgeon that we perform this procedure also, but we give these patients, because they don't feel comfortable with their body, so we give them this opportunity to feel better and to be more comfortable with themselves.
Okay, our dream come true, basically, Noeline. Mushek?
Exactly. No hard work, no nothing. You just go in and come out. Is it that instant? The result?
It's not as simple as that. So it's still surgery, so it carries risks. So we need first to assess the patient, discuss with the patient first. We listen to the patient and we listen to his wishes or her wishes, and then we explain the procedure, and there's a process. And when the patient agrees, we go ahead with the surgery. And
there needs to be a preparation.
Exactly, there's a preparation.
And obviously then the recovery time.
Exactly. It's mostly it's a very invasive procedure that we try to perform now, as the surgery and the plastic surgery get many steps now. For this, to get the recovery shorter, with less invasive technique, like that we have less problem with the recovery and less complication after.
Is it done under general anesthetic?
There's some procedure that are done under general, but most of them we try to do them under local anesthetic, yeah.
Okay.
Like that it will be in a day case, it will be safest for the patient and safest for the recovery and safest for me.
So it's not considered as major operations, or
any surgery can carry some risk. So for that we need to give this information to the patient, but we try to reduce the risk by doing this under local anesthetic. If it's possible to do it under local anesthetic, sometimes we need the anesthetist to be with us. So this is very important. Like that, we do it in the safest conditions. So in a theater, with the condition of medical things. We cannot do this in the kitchen or in a place.
Of course not.
This is very important.
Yes, yeah. Yes. But what fascinates me is that you use the fat of that same person
exactly.
to transfer it somewhere else.
Because we all have a section of our body where we would like to have some fat removed, and that would be hitting two birds with one stone.
Yeah, so this is the new thing, this is the new advance in cosmetic and reconstructive surgery, the use of the fat. Before the fat was something banned, now the fat is something that is getting really...
it's being recycled.
Sort of. Which is exactly. Now the fat, really, we are using it for reconstructive surgery, for example, after breast mastectomy, we can use to reconstruct the breast with the fat.
Of course.
With many other areas of the body, the face, for rejuvenation. The fat contains many good hormones, many good qualities that rejuvenate the face, that gives a good aspect to the face. And it's our own fat. So sometimes the body changes with time, with the gravity it changes. So we lose some fat from some parts of the body and we gain it in other parts.
Other parts.
So, and this may give not a good shape to the person.
Because it's usually not the part that we want it to go.
Exactly, so not the part that we want to go. So what we will do with this procedure is taking the fat, for example, from the waist and add it to the hips and add it to the buttocks sometimes, and this give a nice curve to the patient.
Can the patient choose herself or himself from where he'd like the fat to be removed?
Yes, mostly the patient choose, because when they come to us, they ask us who the waist, for example, or the tummy are bothering them. They cannot.
The buttocks,
exactly. Yes, the tummy and the flanks, and then we remove, for example, sometimes the patient are very straight, like a masculine shape, so they're not happy with that. So we need to give them this curve, and this curve is done by taking the fat from some areas, which is the tummy mostly, and for women, and the waist and the flanks, and then adding this fat to the lateral thighs or to the buttocks, yes.
Okay. Let me just go to Maltese for a few seconds, if you don't mind. Qegħdin nitkellmu ma' Dr. Hamza bil-lingwa Ingliża, ovvjament, għaliex literalment qiegħed hawn Malta għal ftit sigħat qegħdin ingawdu l-kumpanija tiegħu u xtaqna ħafna niltaqgħu miegħu. Qed jitkellem dwar din is-sistema ta' aħna ngħidulu meta topera lilek innifsek biex tidher aħjar. Qegħdin nitkellmu dwar min jixtieq ikabbar is-sider jew ikabbar il-warrani biex ikun iktar tont u finalment huwa body sculpture. Il-ġisem finalment huwa ħajaħdem fuq il-figura li aħna ngħidula l-hourglass, il-fatt li għandek dik il-forma li diħla l-ġewwa mbagħad ħirġa l-barra. L-idea hi illi b'differenza minn kif kienet tinħadem qabel, illum il-ġurnata qegħdin jieħdu x-xaħam minn post żejjed. Pereżempju jekk inti għandek ħafna xaħam fuq iż-żaq madwar id-dawra taż-żaq, allura jittieħed minn hemm u mbagħad jiżdied fejn inti tixtiequ hawn min forsi jixtiequ mas-sider hawn min jixtiequ forsi man-naħa ta' wara, kulħadd ikollu dik ix-xewqa biex jħossu aħjar. U allura x-xaħam tal-individwu stess qed jerġa' jiġi injettat fil-ġisem minflok qed ikun hemm xi ħaġa esterna. Issa jiena li ħanistaqsi jekk allura hemmx forsi affarijiet negattivi dwar dan. What I'm saying, I'm explaining in Maltese, and I'm saying, okay, we are going to use our own fat.
Exactly.
However, as we know throughout our own age, we change as well. So even our own fat changes, like you said, the gravity changes. So once you use our own fat, will there be a time when it dissolves into the system, when you lose weight and that fat will go up?
Exactly. This is a very important question because the body changes and the fat that we take from some areas and we move it from the other areas, and we reshape the body on the same time. So the fat, when we take it from one area with a liposuction, it cannot come back after because we have a certain fat cells, a certain number of fat cells that we get after the puberty, and these fat cells will grow up and will shrink depending of our alimentation. So if we have 1,000 cells and we take 500, we cannot be back to 1,000. This is the most important things about the fat cells.
So let me just clear this because I'm not clear. Let's say I have an issue with my hips, right?
Exactly.
And I would tell you, I'll come and I tell you, listen, take off the hip from the hips and give them to the upper part, which is always seems to be lacking. But anyway, let's not go there. What you're saying is that around my hips, I would never have that same problem.
Never have that. Exactly. Never. The shape will remain forever.
That's good.
Yeah. This is.
But what about the transfer of the fat?
You may
will
lose.
that be this is you may lose it.
So this is the second part of the question. Yes, you may lose some part of this fat, but what remains will remain forever. So the calculation.
I guess it's like any fillers in a way, but at least it's organic. It's yours.
It's organic, exactly, because these are fat cells. So these fat cells will be revasculated, and it will be your own fat. With other fillers, they will dissolve because it's a product.
Eventually, yes.
And this is your own fat. So when the fat cells will grow there, you lose maybe 20 to 30% sometimes of what we inject. So we overcorrect all the time.
So that's not a lot.
It's not a lot. And this is what's the advance in this procedure is we are trying to get this fat staying as long as possible, less the resorption as possible. Yes. So this is the technique.
Yes.
Maybe when we start this 15 years ago, the resorption was very high, 50%, 60%. Now the more we are, because the technique are more performed and everything is getting better and better to get this fat staying there as much as we can.
We mentioned automatically a subject like this, we tend to think females. However, you mentioned in the beginning males and females.
Yes.
Females, okay, we're familiar with the fact that they
Sure.
fill up the top area, the breast area, or the buttocks area. What about the males? What kind of interventions do they ask for?
The male, they ask mostly for the liposuction. So this
Just
is
to take off,
just to
not
take off.
to put it back in somewhere else.
No, really, for the exceptionally, sometimes they want to add this to the pectoral area.
Okay.
Give the pectoral,
Just to give it more like the six-pack? Will that work?
Yes, exactly, like the six-pack. But this is not as frequent as for the female.
For the females, yeah.
For males, mostly it's to take the fat from the tummy, from the back, from the waist, and to reshape a little bit to help the male a little bit to feel much better. Yeah.
Okay. Now, Noeline started the conversation, and I was as well over there, like the fact that, okay, no hard work, and yet you gain all the benefits.
Yes.
I'm sure that the procedure itself, there is an element of pain and an element of downtime in it as well.
Exactly. So for that, we explained that it's a procedure, so this procedure may carry certain risk, and the patient has to be informed that, yes, there is a recovery.
How long will the recovery period
depending
be?
on how many areas that we treat on
because
the
you
surgery.
have two areas, because you're taking off the fat and injecting it.
Exactly. If you work on one area, for example, just let's say the waist and add it to the buttocks, so just one area. So we can do it under local anesthetic. It's very easy, it's very quick, and the patient can recover after 3 or 4 days. The pain is not very important.
Do you have to put those bandages or
yes,
something like that?
Yes, you need to wear the special garment for at least 4 weeks, this garment to help the skin to shrink, because what happens after is there's always swelling, so the patient, we need to inform him that you will not get the result as quickly as he can imagine. So we need to give time to that, and the final result, you can get it only between 4 and 6 months, not before that.
Okay.
So,
but then it's there.
Yeah,
it's there to stay.
Exactly. So when it's there, it's there. So it will not
What
move
about
again.
scarring?
The scar for the liposuction are very minimal scars, so it's a very small scar that we can hide them in many places, under the buttocks or completely on the bikini. It's a very small scar, so the scar is 5 millimeters.
Okay,
So just for the introduction of the cannula that we aspirate the fat and we inject the liquid before, yes.
Are there any, I don't know, predominant conditions of certain people whereby it would inhibit people from doing the procedure? May it be, I don't know, diabetes or...
Yes, sure. So we need to check medically the patient before we do the surgery, and if there is any medical condition that is limit, so sometimes we tell the patient, we need to wait, you need your diabetes to be equilibrated. We need, yes, it's very important to do the medical assessment before.
Okay.
And also to listen to the patient, and sometimes we refuse the patient because they have unrealistic expectation. So for that, we need to tell them that we cannot give you this, make you happy with this procedure, because they want a huge bump, for example, or they don't have enough fat and they want something which is not realistic. So for that, we need to see the patient, to discuss with them, and we tell them we cannot do it for you. So it's better to do something else.
Something else. What you mentioned risks.
Exactly, this is very important.
What are the most common risks, or
so the most
that the patient should be aware of?
Yes. So the risk of any surgery. So for that, he needs to accept, when we inject any liquid, so maybe anaphylactic shock. So for that, we need to do this in with the hospital or location that we can do any medical treatment in case of any problem. And the specific problem that may happen with the fat injection is, we call this the fat necrosis, which is some part of the fat that we inject dies. It's not a big complication, but the patient has to be aware of that when it happens, so he needs to come back.
What happens when it dies?
It's a kind, it dies and make sometimes a kind of small cyst.
Which could be dangerous, or no?
No, it's not dangerous. No, really, it may be aesthetically deformation, small deformation, but it's not dangerous. No, it's not dangerous.
Okay.
We've already run out of time. I'm very sorry, but I really appreciate. Yes, and I would have liked to go in further in Maltese, ma provaw f'muna li xtaqna nassorbu kemm nistgħu minnu. Fuq il-Facebook ħantellaw ukoll xi ritratti li ħassejna li forsi jkunu impertinenti ntellawhom fuq il-televiżjoni minħabba l-ħin tal-programm. Jiġifieri għaliex meta tarhom tajt possibbli, ma vera minn daqshekk. So ħafna. Dr. Hamza, welcome to Malta.
Thank you.
I know you're only here for a few hours. I hope the weather will hold and you'll enjoy your stay here. It's been a great pleasure. We appreciate a lot. Thank you, Noeline.